Next up is our fourth nonprofit, College Diabetes Network, represented by Christina Roth.
Hi, everyone. My name's Christina Roth, and I'm the CEO and the founder of the College Diabetes Network, or CDN. We're a national nonprofit organization whose mission is to provide innovative peer-based programs which connect and empower students and young professionals to thrive with diabetes. To help you understand a little bit about us, I'll tell you about myself first. At the age of 14, like 3 million other people in the United States, for reasons that no one can still define, I was diagnosed with type 1 diabetes. It's an autoimmune disease, and for years, I truly struggled with it. And then I found myself as a freshman in college, where I didn't have the support of my parents, and there was no organization or systems in place to support me. And college, as some of you might remember, is a time when you find yourself, you discover new things, you meet new people. And this can be kind of dangerous for someone with diabetes because often these students will simply leave their diabetes at home, which tends to be a recipe for disaster. However, meeting and connecting with others going through the same thing can have a transformational effect. And because there were no resources available and nothing in place at the time, I founded CDN at UMass Amherst in 2009. We support young adults with diabetes in leading more connected, engaged, and empowered lives. When I founded the organization 7 years ago, we had one chapter, no staff, and absolutely no budget. I was a psychology major. In 2012, I left my job, and I invested all of my energy into the organization to get it off the ground. From those humble beginnings, this organization has grown to over 75 formally affiliated chapters on campuses throughout the country. Our growth rate, we anticipate having over 130 by the end of the year, and we've raised over $2 million towards our mission. We'll soon be announcing national partnerships with both the American Diabetes Association and the Juvenile Diabetes Research Foundation, and they are public, so that's fine to say. And we were featured on CNN Health last year as well in thousands of their clinics. On top of this, we've built a successful corporate membership program which leverages our access to this sought-after population to help provide us with the financial resources that we need. And it includes support from pharma giants such as Eli Lilly and Novo Nordisk. To supplement this, we also pursue philanthropic funding from individuals and foundations such as the Helmsley Charitable Trust. Our model leverages the power of peer support and the transformational experience of community. It's supplemented by a suite of programs to address the lack of systemic supports available to the population. Diabetes is an epidemic, and the current healthcare system is completely inequipped to manage the disease. It's a chronic condition managed 24/7 by the patient, and right now, people are only seeing their doctor for 30 to 45 minutes a year. So the cost of these long-term complications, such as kidney and eye disease, as well as acute care costs, such as ER visits, are crippling our system. And young adults are a lost population within this, experiencing some of the worst outcomes of any demographic with diabetes. In our experience, this translates to higher dropout rates and significantly higher utilization of ER services. CDN is the only organization which provides the tools for this population to live healthy and productive lives, and in an environment where too often they fall through the cracks. While we focus on a very specific demographic at a very specific time in life, our impact goes far beyond. We provide the tools and a network which they carry with them through the rest of their lives. And through all of this, we're transforming the way that people think about and meet the needs of young adults with diabetes, as well as empowering and equipping the next generation of leaders in this industry. Thanks so much.